Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. David Michaels, who ran the Occupational Safety and Health Administration, or OSHA, during the Obama administration. They discuss the recent Supreme Court ruling on vaccine mandates and how OSHA can step up to protect worker safety in spite of it. Let's listen.
David Michaels, thanks so much for joining me.
Well, it's great to be with you. Thanks for inviting me.
So the Supreme Court recently dealt a blow to vaccine mandates for large employers in the United States for COVID. But that doesn't mean the end of mandates, does it?
I don't think it does. And also, the OSHA requirement wasn't strictly a vaccine mandate. It was really a workplace safety rule that said if a worker is not vaccinated, then they have to wear a mask to protect other workers, and they have to be tested weekly so that workers who are infectious are more likely to stay home. So while it was stopped by the Supreme Court, it was stayed officially. It's dead, as far as I can tell. But requirements at workplaces around vaccinations are not dead. Many employers are voluntarily requiring vaccinations of all or most of their workers. And the government, I think, still does have some options that they could pursue, because we know vaccinations are a phenomenally important part of protecting the public, protecting other workers, and stopping this pandemic.
So I just want to back people up a little. You are a former OSHA administrator. You started talking about these OSHA regulations. The Supreme Court was based on an OSHA rule. Is that correct?
That's correct. The Supreme Court looked at two different government rules, one coming from CMS, the Center for Medicare and Medicaid Services, that said that if you want to receive money from that system, you have to make sure all of your employees are vaccinated. And that's really to protect patients, to protect elderly patients, to protect the disabled. And the Supreme Court said that was acceptable. But the OSHA rule was, as I said, stayed by the Supreme Court. And that's the one that really OSHA has to go back to square one in some ways.
So we are seeing some companies who have ended their vaccine mandates. I saw Starbucks for one. So does that mean that we might see more of that?
This really is a changing set of circumstances on a regular basis. Some companies have embraced this idea, recognizing that requiring vaccinations is good for the company, good for employees, and for many public-facing companies, it's good for their clients and customers as well, which is why Starbucks rolling back their requirement was sort of a surprise. United Airlines, some months ago, announced that all of their employees would have to be vaccinated or they would lose their job. And there were big headlines, 600 United employees were let go, essentially. It sounds like a lot, but United has 67,000 workers, so it was well under 1% of the workforce, which is really basic. That's turnover on a regular basis. But it's made a big difference. Earlier in the pandemic, United Airlines was one worker a week to COVID. One worker a week was being killed, was dying because of COVID. Right now, that has stopped happening. There are no more deaths related to COVID among United employees. And while they have, as of last week, about 3,000 workers infected with Omicron, none of them were hospitalized. So I think some companies are looking at this and saying, this is something we have to do. Who knows why Starbucks stepped back, but I certainly think that people who go into Starbucks would prefer to have those employees vaccinated for their health and for the health of everybody else.
So talk to me about sort of the key concepts of workplace safety and how they were applied in this case.
This was an odd case in that OSHA didn't introduce the sort of standard I would have liked to have seen, or I would have tried to do if I were head of OSHA. to control COVID in the workplace, you would essentially apply what we call the hierarchy of controls, which is the standard industrial hygiene approach to any hazard, to asbestos, to silica. The most important thing is to eliminate the hazard from the workplace. And the way to do that with COVID, vaccinations help, but a program that detects people who are infectious and makes sure that they don't stay in the workplace, that they don't enter the workplace, is the most effective thing. So really what I would have liked to have seen, and I hope OSHA eventually gets there, are requirements to provide paid medical leave. That if you develop COVID, you should know you don't have to come to work and you will be paid, because that's the only way to make sure that you're not going to infect other people. After that, in the hierarchy, we should think about increased ventilation and filtration, making sure the air is clean. And finally, if that doesn't work, then you think about density issues, keeping people separate, and wearing masks. Now, vaccinations are on top of all of that, and that's important. It's particularly protective of the individual worker who's vaccinated, but also to some extent stops transmission or slows transmission. That was very much the case before Omicron, but what we discovered with Omicron is that people who are vaccinated still can get sick and they can transmit it. So vaccinations are only one component of really a comprehensive workplace safety program around COVID-19.
Mm-hmm. Has OSHA made companies improve their ventilation and improve their filtration, or is that not a step that has been taken?
No, and I think there are lots of reasons why it probably hasn't. I think politically it's very controversial, and I think the Biden administration is probably afraid to unleash OSHA. But OSHA did issue an emergency temporary standard for hospital workers, for healthcare workers, and that was effective. And that essentially said to employers, look, what you have to do is look at your hazards, make a plan, and figure out how you're going to protect healthcare workers. It wasn't a perfect standard. It wasn't as comprehensive as I would have liked, but it really did have some impact. And it was suspended after 6 months by OSHA, I think primarily because the administration was afraid that it would adversely impact the case for the Supreme Court. Probably didn't make a difference if they suspended it or not. But I would like to see OSHA reintroduce that standard on a permanent basis for healthcare workers, because healthcare workers need to be protected. We can't afford to let healthcare workers get sick from COVID-19, from influenza, from any other airborne infection, because we need them to be there to function, to take care of the rest of us. So I'd like to see that happen, and that would essentially help push healthcare facilities to clean the air in those facilities. But OSHA hasn't done that for any other industry.
Aren't hospitals better ventilated than other places?
Not necessarily. Up until recently, the people who run hospitals and the American Hospital Association clung to this really incorrect idea that COVID-19, as well as influenza, is spread primarily by droplets. These are fairly large particles that come out from people who are coughing, in some cases singing, or are generated when there are procedures that people are working on your lungs or on your respiratory system in the hospital. But we know that's wrong. And we've known that's been wrong for at least a dozen years or longer. COVID is spread by droplets, but also by tiny aerosol particles, which are not visible. They can't be stopped by a classic surgical mask. You really need a much better respirator, an N95. And the virus can enter the ventilation system and just go to faraway rooms. There's a really important study done at one of the big Boston, Harvard-affiliated hospitals, where they looked at a bunch of cases of COVID, and they did genomic sequencing, so they know exactly who spread the virus to whom. And they showed that workers and patients who were nowhere near the original cases were infected because the virus could spread so easily. So it turns out that hospitals don't have systems that really provide clean air. They can move air from one place to another, but if you're moving the virus with it, that ventilation system isn't any good.
Do you see sort of a change in how hospitals are built going forward and ventilation systems, et cetera?
I certainly hope so. I think that it's been a struggle to get the CDC to acknowledge that we have aerosol transmission, and the hospitals have opposed it for both because I think they don't want to have to rebuild their ventilation systems. They cling to what they were taught, these experts 20, 30 years ago. The other thing is, if you have airborne or aerosol transmission, you've got to give workers N95s, as the surgical mask doesn't work. And then if an employer says you must wear an N95, that triggers an OSHA rule, the Respiratory Protection Program rule, which means for every one of those workers, they have to be given a medical exam and to see that they can wear this respirator, and a fit test to make sure it fits. And so that's going to lead to big changes in hospitals. I think in the short run, in the very short run, I'd like to see this tomorrow. I think there are systems that can be implemented that will decrease exposure in hospitals and in other work settings. I think any employer can start building these small contained, what are called Corsi-Rosenthal boxes. And you could Google that if you're interested. These are essentially, it's a fan that's enclosed with 4 HEPA filters that just bring the air through these HEPA filters and clean the virus from the air. And that can be placed in a patient's room. It can be placed in a school, in an office, in a small room in a factory, in a home. And these are very effective. So I think we have to be thinking about short-term solutions and long-term solutions as well.
So in light of the Supreme Court decision, what do you see happening with OSHA moving forward?
Well, there are 2 issues, I think, what I see happening and what I hope to happen. The Supreme Court essentially was divided into 3 factions. There was the 3 dissenters who said, look, OSHA could do this rule is fine. And there were the 3 really arch conservative justices who said that anything that OSHA does in this area really is beyond what's allowed. Essentially what they said was, 51 years ago when Congress passed this law, Congress didn't specifically say to OSHA, this is what you must do around, COVID-19 or something like that. And therefore, since Congress didn't specify that, OSHA can't do it. Of course, that's an absurd position. But these 3 other justices who were sort of in the middle said, OSHA can't pursue or shouldn't be able to pursue this particular regulation, really around this question of vaccinations and COVID-19 being a sort of a hazard that's all over, that's in and out of the workplace. But OSHA could issue a regulation or regulations aimed at high-risk COVID workplaces like meatpacking plants or healthcare facilities, that would be acceptable. So that's 6 votes in favor of a more traditional OSHA standard, a risk-based standard where OSHA says if you've got a situation where you've got large numbers of workers or COVID patients in one place, and there's risk of exposure and increased risk of exposure, OSHA could issue a more traditional rule requiring things like better ventilation and filtration or masking. The justices weren't specific about ventilation, but that's clearly within the framework of what they talked about. So I'd like to see OSHA actually issue, in the short run, a rule like that for healthcare facilities, because as I said, healthcare facilities badly need workplaces to be safe, but also to think about that for all sorts of the types of facilities where there are outbreaks going on all the time right now in meatpacking plants and warehouses and in factories where workers are close together. If you're going to put people close together, you sometimes see pictures of these plexiglass barriers or plastic barriers between workers on assembly line. That does no good at all. That's theater. I mean, it doesn't really have a useful impact in reducing transmission. And so I'd like to see OSHA move in that direction.
I guess my last question is, some of this feels like, just because it's not explicitly stated in the law that everyone has to have a vaccination against COVID, I guess I go back to sort of the purpose of OSHA. I mean, isn't it supposed to protect workers from becoming sick on the job?
That's right. I mean, OSHA law is very straightforward. It says that employers have to provide a workplace free of recognized hazards. And OSHA's job is to make sure employers do that. And so this is in some ways, the situation for which OSHA was invented, where you've got thousands of workers being killed, hundreds of thousands of workers being sickened by a workplace hazard. So I'd like to see OSHA do more. Certainly OSHA is doing much more now than it did during the Trump administration. It's doing very much more meaningful inspections and issuing some big fines, but that's not enough. The game changer is issuing a standard that says to all employers, this is what you must do. And so I'm hoping OSHA is given the opportunity to do that.
David Michaels, thanks so much for joining me.
It was my honor. Thank you so much.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Niall Owen McCusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.